All right, so I got a study here for you guys that is really just yet another piece of evidence in this seemingly infinite string of pieces of evidence that we have towards why we need to be moving towards a Medicare for all single payer system instead of our current ridiculous, rapacious, privatized healthcare system that we have. And so I got a study here that is from the Commonwealth that is basically just outlining all of the data points between comparing the US healthcare system compared to basically all of the other OECD developed nations and how their healthcare systems are functioning, how much their people are paying for healthcare, and what their health outcomes are in correspondence with these. And not going to be surprising to most people who watch my videos, we rank dead last. So time for Medicare for all. US healthcare system ranks dead last among rich nations. Yet again, okay, so there's no question Pramila Jayapal had to say our cruel for-profit healthcare system is broken. So here are some of the data points they say. The United States spends far more of its GDP on healthcare than other rich countries, and yet still has the highest infant and maternal mortality rates, the lowest life expectancy at age 60, and the most glaring inequalities, according to a new report released Wednesday by the Commonwealth Fund. They used a range of criteria to evaluate healthcare systems of 11 countries, including Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, the UK, and the US. And they found that the latest analysis shows that the US, once again, ranks last on access to healthcare, administrative efficiency, equity, and healthcare outcomes. So not only are we spending more, we're the least efficient system in the world, but we also have worse health outcomes. And it's really not surprising if you know anything about our healthcare system on this administrative efficiency question, right? Obviously we are going to be the least efficient when we allow private health insurance companies, private pharmaceutical companies who do nothing but price gouge you and basically deny you care, profit from denying you care and denying you access to the healthcare that you need. These companies exist for no purpose other than to extract profits from our broken healthcare system. They don't provide any actual services, and so that's why we would have an administrative efficiency that ranks dead last among all these other countries who have some variation of a single payer system. So just more of the data points here. Despite sky-high spending fueled by several factors, including exorbitant prices on prescription drugs and medical services, the U.S. ranked last in 9 of the Commonwealth Fund's 10 outcome measures, 9 out of 10, including preventable mortality, 177 deaths per 100,000, life expectancy at age 60, and infant mortality. And in addition to that, the United States maternal mortality rate, 17.4 deaths per 100,000 live births, is more than 2 times higher than France's at 7.6 deaths. So you tell me, why exactly should the United States have a higher maternal mortality rate than France? Okay, are the French really that much better than us? Are they doing something that we can't do? I don't think so. I refuse to believe that, okay? France, you're okay. You're not that great. The United States, we should be doing a lot better than that, okay? So here they plot out the differences in how we are, our performances compared to spending. And we are the outlier here. We're barely even on the graph compared to the rest of these countries, right? You have Australia, the Netherlands, Norway, New Zealand. They're all up here in terms of higher health system performance versus lower health system performance. We're dead last at the bottom here in terms of performance, and then we're higher than anybody else in terms of spending. So we have the most expensive, the least efficient system that is producing the worst health outcomes of all of these other developed wealthy nations. Why is that? Again, because of the profit motive, because we have these privatized healthcare system that treats healthcare instead of as a human right, as a commodity that is to be used for nothing other than profit extraction for these gigantic health insurance and big pharmaceutical companies. They continue basically just outlining exactly why we need a single payer system here. One potential cause of poor healthcare outcomes in the US, the report notes, are deep inequalities in access to the expensive system, which is in large part dominated by major private insurance companies and for-profit hospital systems. So exactly what I just said. And they continue providing some of the solutions that we could use to remedy some of these problems. The Commonwealth Fund spotlights 4 features of high-performing healthcare systems that allow them to deliver far superior care for less cost than the fragmented U.S. system. 1, they provide for universal coverage and remove cost barriers. Wow, it's almost like we should nationalize our healthcare system. They invest in primary care to ensure that high-value services are equitably available in all communities to all people. They reduce administrative burdens that divert time, efforts, and spending from health improvement efforts. The perfect example that I had from this is that I covered it in a previous video a while back. Maybe it was a month ago now, but where Katie Porter was slamming in on one of these big pharmaceutical executives. And she basically pointed out that among the entirety of all of these big pharmaceutical companies, when they claim that, oh, well, if you nationalize big pharma, you're going to stifle medical innovation, it's complete bullshit. They're spending more on executive bonuses and stock buybacks than they actually spend on research and development, on innovating new medicines. And that's what they're pointing out there. They reduce administrative burdens that divert time, effort, and spending from health improvements. So in other words, if we nationalized our healthcare system, it would be more efficient at innovating in terms of medical innovations, because you wouldn't have to be spending a lot of that money on executive bonuses and stock buybacks. You could actually invest it in medicine. So again, completely dismantling this conservative talking point that they will often troll out in response to these types of things. They continue, they reduce administrative burdens. Sorry, I already read that. They invest in social services, especially for children and working age adults. So listen, all of this is just to make the same exact point that we've been making for years and years and years, since, like, however long universal healthcare or a Medicare for all single payer system has been introduced in the United States. I mean, there were even politicians back like JFK that were supporting nominally things like a single payer healthcare system. Even Nancy Pelosi in the 90s said that she supported a single payer healthcare system and wanted to vote on it. So listen, we've known these solutions for a long time. All you have to do to understand the problems with our broken healthcare system here in the United States is look at what the rest of the developed world is doing. And when you see the results, the most expensive, the least efficient, and the worst health outcomes of all of these other wealthy nations, we can just copy the types of systems that they have over there and we'll get much better results. It's really not that complicated. The only reason that we can't do this is because we have a government that is bought and controlled by a lot of these big pharmaceutical interests and a lot of these health insurance companies that basically bribe them and pay off their campaigns and fund their campaigns so that they will go and oppose legislation like Medicare for all. We just saw this with Nina Turner in her race, how a lot of these big moneyed influences started dumping money into her campaign because they know she's not going to go out there and fight for policies like Medicare for all. That's why they would oppose somebody like Nina Turner, who would go fight for Medicare for all. So listen, we know how corrupt the system is. It's pretty much out in the open right now. We know the reasons why we can't actually get a Medicare for all single payer system, but these types of research reports are really useful in continuing these arguments and making the same arguments over and over and over again until we actually reach the point where it's politically feasible and we can start to adjust this ridiculous, rapacious, for-profit privatized healthcare system that we have here.